Mercury poisoning is a type of metal poisoning and a medical condition caused by exposure to mercury or its compounds. Mercury is a heavy metal occurring in several forms, all of which can produce toxic effects in high enough doses. Its zero oxidation state HGO exists as vapor or as liquid metal, its mercurous state Hg22+ exists as inorganic salts, and its mercuric state Hg2+ may form either inorganic salts or organomercury compounds. The three groups vary in effects. Toxic effects include damage to the brain, kidneys and lungs. Mercury poisoning can result in several diseases, including acrodynia, Hunter-Russell syndrome, and Minamata disease. Symptoms typically include sensory impairment, disturbed sensation and a lack of coordination. The type and degree of symptoms exhibited depend upon the individual toxin, the dose, and the method and duration of exposure. Signs and symptoms. Common symptoms of mercury poisoning include peripheral neuropathy, skin discoloration, swelling, and desquamation. Mercury irreversibly inhibits selenium-dependent enzymes and may also inactivate S-adenosylmethionine, which is necessary for catecholamine catabolism by catechol-O-methyl transferase. Due to the body's inability to degrade catecholamines, a person suffering from mercury poisoning may experience profuse sweating, tachycardia, increased salivation, and hypertension. Affected children may show red cheeks, nose and lips, loss of hair, teeth, and nails, transient rashes, hypotonia, and increased sensitivity to light. Other symptoms may include kidney dysfunction or neuropsychiatric symptoms such as emotional lability, memory impairment, and/or insomnia. Thus, the clinical presentation may resemble pheochromocytoma or Kawasaki disease. An example of desquamation of the hand of a child with severe mercury poisoning acquired by handling elemental mercury is this photograph in Horowitz, al. Causes. The consumption of fish is by far the most significant source of ingestion-related mercury exposure in humans and animals, although plants and livestock also contain mercury due to bioconcentration of mercury from seawater, freshwater, marine and lacustrine sediments, soils, and atmosphere, and due to biomagnification by ingesting other mercury-containing organisms. Exposure to mercury can occur from breathing contaminated air, from eating foods that have acquired mercury residues during processing, from exposure to mercury vapor in mercury amalgam dental restorations, and from improper use or disposal of mercury and mercury-containing objects, for example, after spills of elemental mercury or improper disposal of fluorescent lamps. Consumption of whale and dolphin meat, as is the practice in Japan, is a source of high levels of mercury poisoning. Tetsuya Endo, a professor at the Health Sciences University of Hokkaido, has tested whale meat purchased in the whaling town of Taiji and found mercury levels more than 20 times the acceptable Japanese standard. Human-generated sources, such as coal-fired power plants, emit about half of atmospheric mercury, with natural sources such as volcanoes responsible for the remainder. An estimated two-thirds of human-generated mercury comes from stationary combustion, mostly of coal. Other important human-generated sources include gold production, non-ferrous metal production, cement production, waste disposal, human crematoria, caustic soda production, pig iron and steel production, mercury production, and biomass burning. Small independent gold mining operation workers are at higher risk of mercury poisoning because of crude processing methods. Such as the danger for the Galamsey in Ghana and similar workers known as orpailleurs in neighboring francophone countries. While no official government estimates of the labor force have been made, observers believe 20,000 to 50,000 work as Galamseys in Ghana, a figure including many women, who work as porters. Similar problems have been reported amongst the gold miners of Indonesia. Mercury and many of its chemical compounds, especially organomercury compounds, can also be readily absorbed through direct contact with bare, or in some cases insufficiently protected, skin. Mercury and its compounds are commonly used in chemical laboratories, hospitals, dental clinics, and facilities involved in the production of items such as fluorescent light bulbs, batteries, and explosives. On the other hand, no scientific data supports the claim that mercury compounds in vaccine preservatives cause autism or its symptoms. Mechanism: mercury is highly reactive with selenium, an essential dietary element required by about 25 genetically distinct enzyme types. Among their numerous functions, selenoenzymes prevent and reverse oxidative damage in the brain and endocrine organs. The molecular mechanism of mercury toxicity involves its unique ability to irreversibly inhibit activities of selenoenzymes, such as thiodoxin reductase. Although it has many additional functions, thiodoxin reductase restores vitamin C and E, as well as a number of other important antioxidant molecules, back into their reduced forms, enabling them to counteract oxidative damage within body cells. Since the rate of oxygen consumption is particularly high in brain tissues, production of reactive oxygen species is accentuated in these vital cells, making them particularly vulnerable to oxidative damage and especially dependent upon the antioxidant protection provided by selenoenzymes. High mercury exposures deplete the amount of cellular selenium available for the biosynthesis of thiodoxin reductase and other selenoenzymes that prevent and reverse oxidative damage, which, if the depletion is severe and long-lasting, results in brain cell dysfunctions that can ultimately cause death. Mercury in its various forms is particularly harmful to fetuses as an environmental toxin in pregnancy, as well as to infants. Women who have been exposed to mercury in substantial excess of dietary selenium intakes during pregnancy are at risk of giving birth to children with serious birth defects. Mercury exposures in excess of dietary selenium intakes in young children can have severe neurological consequences, preventing nerve sheaths from forming properly. Mercury inhibits the formation of myelin. According to some evidence, mercury poisoning may predispose to Young syndrome. Because of differences in tissue distributions, mercury poisoning's effects will differ depending on whether it has been caused by exposure to elemental mercury, inorganic mercury compounds, or organomercury compounds. Elemental mercury, quicksilver, is poorly absorbed by ingestion and skin contact. It is hazardous due to its potential to release mercury vapor. Animal data indicate less than 0.01% of ingested mercury is absorbed through the intact gastrointestinal tract, though it may not be true for individuals suffering from ileus. Cases of systemic toxicity from accidental swallowing are rare, and attempted suicide via intravenous injection does not appear to result in systemic toxicity. Though not studied quantitatively, the physical properties of liquid elemental mercury limit its absorption through intact skin, and in light of its very low absorption rate from the gastrointestinal tract, skin absorption would not be high. Some mercury vapor is absorbed dermally, but uptake by this route is only about 1% of that by inhalation. In humans, approximately 80% of inhaled mercury vapor is absorbed via the respiratory tract, where it enters the circulatory system and is distributed throughout the body. Chronic exposure by inhalation, even at low concentrations in the range 0.7 I 1/4 gram per meter 3, has been shown in case control studies to cause effects such as tremors, impaired cognitive skills, and sleep disturbance in workers. Acute inhalation of high concentrations causes a wide variety of cognitive, personality, sensory, and motor disturbances. The most prominent symptoms include tremors, emotional lability, insomnia, memory loss, neuromuscular changes, headaches, polyneuropathy, and performance deficits in tests of cognitive function. Inorganic mercury compounds: mercury occurs inorganically as salts such as mercury, chloride. Mercury salts affect primarily the gastrointestinal tract and the kidneys, and can cause severe kidney damage. However, as they cannot cross the blood-brain barrier easily, mercury salts inflict little neurological damage without continuous or heavy exposure. As two oxidation states of mercury form salts, mercury salts occur in both mercury, I, and mercury, forms. Mercury, salts are usually more toxic than their mercury, I, counterparts because their solubility in water is greater. Thus, they are more readily absorbed from the gastrointestinal tract. Mercuric cyanide, Mercuric cyanide Hg, Cn, is a particularly toxic mercury compound. If ingested, both life-threatening mercury and cyanide poisoning can occur. Hg, Cn, can enter the body via inhalation, ingestion, or passage through the skin. Inhalation of mercuric cyanide irritates the throat and air passages. Heating or contact of Hg, Cn, with acid or acid mist releases toxic mercury and cyanide vapors that can cause bronchitis with cough and phlegm and/or lung tissue irritation. Contact with eyes can cause burns and brown stains in the eyes, and long-time exposure can affect the peripheral vision. Contact with skin can cause skin allergy, irritation, and gray skin color. Chronic exposure to trace amounts of the compound can lead to mercury buildup in the body over time. It may take months or even years for the body to eliminate excess mercury. Overexposure to mercuric cyanide can lead to kidney damage and/or mercury poisoning, leading to shakes, irritability, sore gums, increased saliva, metallic taste, loss of appetite, memory loss, personality changes, and brain damage. Exposure to large doses at one time can lead to sudden death. Mercuric cyanide has not been tested on its ability to cause reproductive damage. Although inorganic mercury compounds too have not been shown to be human teratogens, they should be handled with care, as they are known to damage developing embryos and decrease fertility in men and women. According to one study, 2 people exhibited symptoms of cyanide poisoning within hours after ingesting mercuric cyanide or mercury oxycyanide, Hg, Cn, €1 HgO, in suicide attempts. The toxicity of Hg, Cn, is commonly assumed to arise almost exclusively from mercury poisoning. However, the patient who ingested mercury oxycyanide died after 5 hours of cyanide poisoning before any mercury poisoning symptoms were observed. The patient who ingested Hg, Cn, initially showed symptoms of acute cyanide poisoning, which were brought under control, and later showed signs of mercury poisoning before recovering. The degree to which cyanide poisoning occurs is thought to be related to whether cyanide ions are released in the stomach, which depends on factors such as the amount ingested, stomach acidity, and volume of stomach contents. Given that Hg, Cn, molecules remain undissociated in pure water and in basic solutions, it makes sense that dissociation would increase with increasing acidity. High stomach acidity thus helps cyanide ions to become more bioavailable, increasing the likelihood of cyanide poisoning. Mercury cyanide was used in 2 murders in New York in 1898. The perpetrator, Roland B. Molyneux, sent poisoned medicines to his victims through the U.S. mail. The first victim, Henry Barnett, died of mercury poisoning 12 days after taking the poison. The second victim, Catherine Adams, died of cyanide poisoning within 30 minutes of taking the poison. As in the suicide cases, the difference between the 2 cases may be attributed to differences in the acidities of the solutions containing the poison, or to differences in the acidities of the victims' stomachs. The drug N-acetylpenicillamine has been used to treat mercury poisoning with limited success. Organic mercury compounds of mercury tend to be much more toxic than the elemental form, and organic compounds of mercury are often extremely toxic and have been implicated in causing brain and liver damage. The most dangerous mercury compound, dimethylmercury, is so toxic that even a few microliters spilled on the skin, or even a latex glove, can cause death, as in the case of Karen Wetterhahn. Methylmercury. Methylmercury is the major source of organic mercury for all individuals. In Norway, amalgam fillings are banned due to concerns over public health and environmental pollution. Due to bioaccumulation, it works its way up through the food web and thus biomagnifies, resulting in high concentrations among populations of some species. Top predatory fish, such as tuna or swordfish, are usually of greater concern than smaller species. The US FDA and the EPA advise women of childbearing age, nursing mothers, and young children to completely avoid swordfish, shark, king mackerel and tilefish from the Gulf of Mexico, and to limit consumption of albacore tuna to no more than 6 oz per week. and of all other fish and shellfish to no more than 12 Oz per week. A 2006 review of the risks and benefits of fish consumption found, for adults, the benefits of 1 to 2 servings of fish per week outweigh the risks, even for women of childbearing age, and that avoidance of fish consumption could result in significant excess coronary heart disease deaths and suboptimal neural development in children. The period between exposure to methylmercury and the appearance of symptoms in adult poisoning cases is long. The longest recorded latent period is 5 months after a single exposure, in the Dartmouth case. Other latent periods in the range of weeks to months have also been reported. No explanation for this long latent period is known. When the first symptom appears, typically paresthesia, it is followed rapidly by more severe effects, sometimes ending in coma and death. The toxic damage appears to be determined by the peak value of mercury, not the length of the exposure. Ethylmercury is a breakdown product of the antibacteriological agent ethylmercurithiosalicylate TE, which has been used as a topical antiseptic and a vaccine preservative. Its characteristics have not been studied as extensively as those of methylmercury. It is cleared from the blood much more rapidly, with a half-life of 7 to 10 days, and it is metabolized much more quickly than methylmercury. It is presumed not to have methylmercury's ability to cross the blood-brain barrier via a transporter, but instead relies on simple diffusion to enter the brain. Other exposure sources of organic mercury include phenylmercuric acetate and phenylmercuric nitrate. These were used in indoor latex paints for their antimildew properties, but were removed in 1990 because of cases of toxicity. Diagnosis of elemental or inorganic mercury poisoning involves determining the history of exposure, physical findings, and an elevated body burden of mercury. Although whole blood mercury concentrations are typically less than 6 Ai1/4 gram per liter, diets rich in fish can result in blood mercury concentrations higher than 200 Ai1/4 gram per liter. It is not that useful to measure these levels for suspected cases of elemental or inorganic poisoning because of mercury's short half-life in the blood. If the exposure is chronic, urine levels can be obtained. 24-hour collections are more reliable than spot collections. It is difficult or impossible to interpret urine samples of patients undergoing chelation therapy, as the therapy itself increases mercury levels in the samples. Diagnosis of organic mercury poisoning differs in that whole blood or hair analysis is more reliable than urinary mercury levels. Prevention: mercury poisoning can be prevented by eliminating or reducing exposure to mercury and mercury compounds. To that end, many governments and private groups have made efforts to regulate heavily the use of mercury, or to issue advisories about its use. For example, the export from the European Union of mercury and some mercury compounds has been prohibited since 15 March, 2010. The variability among regulations and advisories is at times confusing for the layperson as well as scientists. The United States Environmental Protection Agency issued recommendations in 2004 regarding exposure to mercury in fish and shellfish. The EPA also developed the Fish Kids Awareness Campaign for children and young adults on account of the greater impact of mercury exposure to that population. Treatment: identifying and removing the source of the mercury is crucial. Decontamination requires removal of clothes, washing skin with soap and water, and flushing the eyes with saline solution as needed. Inorganic ingestion such as mercuric chloride should be approached as the ingestion of any other serious caustic. Immediate chelation therapy is the standard of care for a patient showing symptoms of severe mercury poisoning or the laboratory evidence of a large total mercury load. Chelation therapy for acute inorganic mercury poisoning can be done with DMSA, 2,3-dimecapto-1-propanesulfonic acid, D-penicillamine, or dimercaprol. Only DMSA is FDA approved for use in children for treating mercury poisoning. However, several studies found no clear clinical benefit from DMSA treatment for poisoning due to mercury vapor. No chelator for methylmercury or ethylmercury is approved by the FDA. DMSA is the most frequently used for severe methylmercury poisoning, as it is given orally, has fewer side effects, and has been found to be superior to BAL, DPCN, and DMPS. I plus or minus lipoic acid has been shown to be protective against acute mercury poisoning in several mammalian species when it is given soon after exposure. Correct dosage is required, as inappropriate dosages increase toxicity. Although it has been hypothesized that frequent low dosages of ALA may have potential as a mercury chelator, studies in rats have been contradictory. Glutathione and N-acetylcysteine are recommended by some physicians, but have been shown to increase mercury concentrations in the kidneys and the brain. Experimental findings have demonstrated an interaction between selenium and methylmercury, but epidemiological studies have found little evidence that selenium helps to protect against the adverse effects of methylmercury. Chelation therapy can be hazardous if administered incorrectly. In August 2005, an incorrect form of EDTA used for chelation therapy resulted in hypocalcemia, causing cardiac arrest that killed a 5-year-old autistic boy. Prognosis: many of the toxic effects of mercury are partially or wholly reversible either through specific therapy or through natural elimination of the metal after exposure has been discontinued. However, heavy or prolonged exposure can do irreversible damage, in particular in fetuses, infants, and young children. Young syndrome is believed to be a long-term consequence of early childhood mercury poisoning. Mercuric chloride may cause cancer as it has caused increases in several types of tumors in rats and mice, while methyl mercury has caused kidney tumors in male rats. The EPA has classified mercuric chloride and methyl mercury as possible human carcinogens. Detection in biological fluids: mercury may be measured in blood or urine to confirm a diagnosis of poisoning in hospitalized victims or to assist in the forensic investigation in a case of fatal overdosage. Some analytical techniques are capable of distinguishing organic from inorganic forms of the metal. The concentrations in both fluids tend to reach high levels early after exposure to inorganic forms, while lower but very persistent levels are observed following exposure to elemental or organic mercury. Chelation therapy can cause a transient elevation of urine mercury levels. History: the first emperor of unified China, Qin Shi Huang, it is reported, died of ingesting mercury pills that were intended to give him eternal life. The phrase "mad as a hatter" is likely a reference to mercury poisoning among milliners, as mercury-based compounds were once used in the manufacture of felt hats in the 18th and 19th century. In 1810, 2 British ships, HMS Triumph and HMS Aphips, salvaged a large load of elemental mercury from a wrecked Spanish vessel near Cadiz, Spain. The bladders containing the mercury soon ruptured. The element spread about the ships in liquid and vapor forms. The sailors presented with neurologic compromises, tremor, paralysis, and excessive salivation as well as tooth loss, skin problems, and pulmonary complaints. In 1823 William Burnett Maryland published a report on the effects of mercurial vapor. The unregistered trademark surgeon, Henry Plowman, had concluded that the ailments had arisen from inhaling the mercurialized atmosphere. His treatment was to order the lower deck gun ports to be opened, when it was safe to do so. Sleeping on the orlop was forbidden. And no men slept in the lower deck if they were at all symptomatic. Wind sails were set to channel fresh air into the lower decks day and night. Historically, gold amalgam was widely used in gilding, leading to numerous casualties among the workers. It is estimated that during the construction of St. Isaac's Cathedral alone, 60 men died from the gilding of the main dome. For years, including the early part of his presidency, Abraham Lincoln took a common medicine of his time called blue mass, which contains significant amounts of mercury. On September 5, 1920, silent movie actress Olive Thomas ingested mercury capsules dissolved in an alcoholic solution at the Hotel Ritz in Paris. There is still controversy over whether it was suicide, or whether she consumed the external preparation by mistake. Her husband, Jack Pickford, had syphilis, and the mercury was used as a treatment of the venereal disease at the time. She died a few days later at the American Hospital in Neuilly. An early scientific study of mercury poisoning was in 1923 a Euro 6 by the German inorganic chemist, Alfred Stock, who himself became poisoned, together with his colleagues, by breathing mercury vapor that was being released by his laboratory equipment diffusion pumps, float valves, and manometer all of which contained mercury, and also from mercury that had been accidentally spilt and remained in cracks in the linoleum floor covering. He published a number of papers on mercury poisoning, founded a committee in Berlin to study cases of possible mercury poisoning, and introduced the term micromercurialism. The term Hunter-Russell syndrome derives from a study of mercury poisoning among workers in a seed-packing factory in Norwich, England in the late 1930s who breathed methylmercury that was being used as a seed disinfectant and preservative. Outbreaks of methylmercury poisoning occurred in several places in Japan during the 1950s due to industrial discharges of mercury into rivers and coastal waters. The best-known instances were in Minamata and Niigata. In Minamata alone, more than 600 people died due to what became known as Minamata disease. More than 21,000 people filed claims with the Japanese government, of which almost 3,000 became certified as having the disease. In 22 documented cases, pregnant women who consumed contaminated fish showed mild or no symptoms but gave birth to infants with severe developmental disabilities. Widespread mercury poisoning occurred in rural Iraq in 1971 to 1972, when grain treated with a methylmercury-based fungicide that was intended for planting only was used by the rural population to make bread, causing at least 65-30 cases of mercury poisoning and at least 459 deaths. On August 14, 1996, Karen Wetterhahn, a chemistry professor working at Dartmouth College, spilled a small amount of dimethylmercury on her latex glove. She began experiencing the symptoms of mercury poisoning 5 months later and, despite aggressive chelation therapy, died a few months later from brain malfunction due to mercury intoxication. In April 2000, Alan Chmurney attempted to kill a former employee, Marta Bradley, by pouring mercury into the ventilation system of her car. On March 19, 2008, Tony Winnett, 55, inhaled mercury vapors while trying to extract gold from computer parts, and died 10 days later. His Oklahoma residence became so contaminated that it had to be gutted. In December 2008, actor Jeremy Piven was diagnosed with mercury poisoning possibly resulting from eating sushi twice a day for 20 years or herbal remedies he was also taking. In India, a study by the non-profit Centre for Science and Environment has found that in the country's energy capital Singrauli, mercury is slowly entering people's homes, food, water and even blood. Infantile acrodynia. Infantile acrodynia is a type of mercury poisoning in children characterized by pain and pink discoloration of the hands and feet. The word is derived from the Greek, where II means end and II 1/2 I means pain. Also known as pink disease, swift disease, fear disease, Selter disease, erythroderma, erythroderma polyneuritis, dermatopolyneuritis, trophodermatoneurosis, erythema arthricum epidemicum, vegetative neurosis, and vegetative encephalitis. These terms describe different aspects of the syndrome. Acrodynia was relatively commonplace among children in the first half of the 20th century. At first, the cause of the acrodynia epidemic among infants and young children was unknown. However, mercury poisoning, primarily from calomel and teething powders, began to be widely accepted as its cause in the 1950s and 60s. The prevalence of acrodynia decreased greatly after calomel was excluded from most teething powders in 1954. Acrodynia is difficult to diagnose. It is most often postulated that the etiology of this syndrome is an idiosyncratic hypersensitivity reaction to mercury because of the lack of correlation with mercury levels. Many of the symptoms resemble recognized mercury poisoning. Medical procedures. Because elemental mercury often passes through the GI tract without being absorbed, it was used medically for various purposes until the dangers of mercury poisoning became known. For example, elemental mercury was used to mechanically clear intestinal obstructions, and it was a key ingredient in various medicines throughout history, such as blue mass. The toxic effects often were either not noticed at all or so subtle or generic that they were attributed to other causes and were not recognized as poisoning caused by mercury. While the usage of mercury in medicine has declined, mercury-containing compounds are still used medically in vaccine preservatives and dental amalgam, both of which have been the subject of controversy regarding their perceived potential for mercury poisoning. Thiomycin. In 1999, the Centers for Disease Control and the American Academy of Pediatrics asked vaccine makers to remove the organomercury compound thiomycin from vaccines as quickly as possible, and thiomycin has been phased out of US and European vaccines, except for some preparations of influenza vaccine. The CDC and the AAP followed the precautionary principle, which assumes that there is no harm in exercising caution even if it later turns out to be unwarranted, but their 1999 action sparked confusion and controversy that has diverted attention and resources away from efforts to determine the causes of autism. Since 2000, the thiomycin in child vaccines has been alleged to contribute to autism, and thousands of parents in the United States have pursued legal compensation from a federal fund. A 2004 Institute of Medicine committee favored rejecting any causal relationship between thiomycin-containing vaccines and autism. Autism incidence rates increased steadily even after thiomycin was removed from childhood vaccines. Currently there is no accepted scientific evidence that exposure to thiomycin is a factor in causing autism. Dental amalgam toxicity. Dental amalgam toxicity is a possible form of low-level mercury poisoning and other toxicity due to the use of amalgam as the dental material in a dental filling. Discussion on the topic of amalgam includes debates on whether amalgam should be used, with critics arguing that its toxic effects make it unsafe. Some critics further say that if amalgam was used in the past, then it should be removed from the mouth to protect a person's health. Cosmetics. Some skin whitening products contain the toxic chemical mercury, 2, chloride as the active ingredient. When applied, the chemical readily absorbs through the skin into the bloodstream. The use of mercury in cosmetics is illegal in the United States. However, cosmetics containing mercury are often illegally imported. Following a certified case of mercury poisoning resulting from the use of an imported skin whitening product, the United States Food and Drug Administration warned against the use of such products. Symptoms of mercury poisoning have resulted from the use of various mercury-containing cosmetic products. The use of skin whitening products is especially popular amongst Asian women. In Hong Kong in 2002, 2 products were discovered to contain between 9,000 to 60,000 times the recommended dose. Fluorescent lamps. Fluorescent lamps contain mercury which is released when bulbs are broken. Mercury in bulbs is typically present as either elemental mercury liquid, vapor, or both, since the liquid evaporates at ambient temperature. When broken indoors, bulbs may emit sufficient mercury vapor to present health concerns, and the U.S. Environmental Protection Agency recommends evacuating and airing out a room for at least 15 minutes after breaking a fluorescent light bulb. Breakage of multiple bulbs presents a greater concern. A 1987 report described a 23-month-old toddler who suffered anorexia, weight loss, irritability, profuse sweating, and peeling and redness of fingers and toes. This case of acrodynia was traced to exposure of mercury from a carton of 8-foot fluorescent light bulbs that had broken in a potting shed adjacent to the main nursery. The glass was cleaned up and discarded, but the child often used the area for play. Assassination. Mercury has been used at various times to assassinate people. In 2008, Russian lawyer Karina Moskalenko claimed to have been poisoned by mercury left in her car, while in 2010 journalists Viktor Kalashnikov and Marina Kalashnikova accused Russia's FSB of trying to poison them. See also, Diagnosis Mercury, Money, Politics and Poison, Erethism, God Mercury? Lead poisoning, Mercury vacuum, Mercury-containing and rechargeable battery management act, methylmercury, Minamata disease, Niagata Minamata disease, Ontario Minamata disease, references. External links, hazardous substances, mercury at DMOZ, toxic substances, mercury at DMOZ.